So guys, now we shall be moving on to the muscles of the arm. Okay. So regarding the muscles of the arm are divided into two compartments. Okay. So muscles of the arm are basically they are divided into two compartments. So what is your arm? This is your arm, not this entire thing is not your arm. So this part is your arm or brachium. Okay. It is divided into two compartments. Whatever you can see here, this is called as an anterior compartment. Whatever you can see on the back, this is called as a posterior compartment. Okay. So we are dividing the muscles of the arm into anterior compartment. Okay. And next we have got the posterior compartment. Now, muscles of the anterior compartment, these are responsible for flexion. Muscles of the posterior compartment are responsible for extension. What is flexion and extension? See, when I am flexing it, the angle between my forearm and arm, if you look at the angle is reducing. So, reduction of angle is called as flexion. Whereas, if you can see here, this is extension of angle. The angle is getting wider and wider. This is called extension. Okay. So, forearm anterior compartment muscles are always flexors here as well as in the forearm also. All these are the flexors. Okay. And the backside muscles, even in the forearm or in the arm, they are always extensors. Okay. So, in the same way, anterior compartment, or we also call it as flexor compartment. Posterior compartment is also called as extensor compartment. Okay. So, this is the basic rule which you have to remember. So, everywhere in your body, but not in the lower limbs. Okay. Because upper limbs are the opposite of lower limbs. I will tell you anyways when I will be discussing those things. Okay. Now, in this anterior compartment, we have got three muscles. What are those three muscles? BBC. What does BBC stand for? BBC stands for, one is called as biceps muscle, that is your biceps brachii. Okay. Next, B stands for brachialis muscle, and C stands for coracobrachialis muscle. Brachialis muscle. So, you have got three muscles, one is called as biceps brachii, brachialis and coracobrachialis. But on the posterior side, you have got a muscle that is called as triceps muscle. You have got triceps muscle. Okay. So, next important thing is that all these anterior compartment muscles, that is the biceps brachii, brachialis and coracobrachialis, all of them are supplied by a nerve, and that nerve is called as musculocutaneous nerve. That is called as musculocutaneous nerve. Musculocutaneous nerve is the one which supplies all your anterior compartment muscles. In the same way, posterior compartment muscles are supplied by radial nerve. So, in the exam, if they ask you what is the nerve supply of brachialis, then it is musculocutaneous. Okay. So, keep that thing in mind. Okay. Now, one very important thing you need to understand here is that what is the definition of a hybrid muscle? What is hybrid muscle, guys? For example, let us say there is a muscle in our body. Every muscle will be innervated by only one nerve. Okay. So, for example, let us say coracobrachialis innervated by one nerve, musculocutaneous. Right. Radial nerve will not come and innervate it. In the same way, triceps is innervated by radial nerve. Musculocutaneous nerve will not innervate triceps. So, every muscle is innervated by a single nerve. But there are some cases where there are some muscles where every muscle is innervated, a particular muscle is innervated by two nerves. Such muscles are called as hybrid muscles. So, in some individuals, when you look at the brachialis, not in all of them, only in some individuals, brachialis is supplied both by musculocutaneous nerve as well as radial nerve. So, in those individuals, brachialis is called as hybrid muscle. Okay. So, what I was telling you is brachialis in some individuals only, in some individuals, brachialis is supplied by both musculocutaneous nerve along with that radial nerve. Musculocutaneous and radial nerve. Okay. So, that is the reason why this brachialis, whatever is there, you call this brachialis as what? Hybrid muscle. You call this brachialis as hybrid muscle. Okay, right. Next important thing is that if you look at the biceps brachii and triceps, we shall be mainly focusing on these two. Okay, so if you look at biceps brachii, because only these two will be asked again and again in the exam. So if you look at the biceps muscle, biceps muscle, why it is called biceps? Because it has got two heads. One is called as the short head of biceps. Another one is called as the long head of biceps. Now what is this short head and what is this long head? I will tell you later on. But for now, just remember that biceps is having two heads. One is called short head, one is called as long head. Okay. In the same way, this triceps, okay, let me write it down here. The triceps muscle, why it is called triceps? Because it has got three heads. So it has got three heads like this. What are those three heads here? One is called as the long head of triceps. Another one is called as the lateral head of triceps. When I tell lateral head, there will be definitely medial head. So there is also medial head of triceps. So we have got long head, lateral head as well as the medial head of triceps. Okay. So now we shall first focus on the biceps muscle and then we shall go on to the triceps muscle. So if you look here, so I am going to draw the biceps muscle over here. I am going to draw the biceps brachii. Biceps brachii muscle. So what did I tell you in the starting? Biceps brachii has got short head, it has got long head. So short head, it starts from where? From which point does the short head start? Short head originates from the coracoid process. From the coracoid process of scapula. Okay, from the coracoid process of scapula. Now don't confuse coracoid process with coronoid process. Coronoid process is present on ulna bone. This is coracoid process which is present on your scapula. Next we have got the long head. Long head starts from the supraglenoid tubercle. I will show you what is that. Supraglenoid tubercle, right? So if you look at the scapula over here, this is the glenoid cavity, right? Now above this glenoid cavity and below this glenoid cavity, the sharp points whatever are there, this is called as supraglenoid tubercle, this is called as infraglenoid tubercle, right? So if I have to show it to you on the picture, so this would be your supraglenoid tubercle, the down one will be your infraglenoid tubercle. Okay. Now another important thing is that let us finish up this bone over here, and here you have got the radius bone. Here you have got the ulna bone. Okay. On the radius bone, you have got a small tuberosity like this. This is called as a radial tuberosity. You have got a small tuberosity. This is called as the radial tuberosity. This is called as the radial tuberosity, right? Now look here. This muscle, the short head of this muscle originates from the coracoid process. So this is the short head of the muscle which is coming. Okay. Next, the long head of the muscle arises from the supraglenoid tubercle. So the long head of the muscle arises from the supraglenoid tubercle. So both of them, the short head and the long head, right? Both of them, the short head as well as the long head, right? Both of them together, they form this muscle over here. This muscle is called as biceps brachii. And where this muscle gets inserted? Yes, where this entire muscle gets inserted onto the radial tuberosity, which I have already shown. Radial tuberosity, which I have already shown you below here, right? So this is the muscle which is getting inserted all the way till the radial tuberosity. Okay, so this entire thing is your muscle. So this is your biceps brachii muscle. This is your biceps brachii muscle. So short head arises from the coracoid process, long head arises from the supraglenoid tubercle. And what is the nerve innervation? The nerve innervation, all of you know, that is, what is that? Musculocutaneous nerve. And all of you know that biceps muscle will perform flexion of elbow, isn't it? It is responsible for the flexion of elbow. But remember one thing, that biceps muscle is the strongest supinator in your body, right? So this promising is called pronation, receiving is called supination. Now I receive like this, I don't receive like this, right? So I receive like this. So this is called supination, right? And if I am promising someone, this is called pronation. So this action or supination action is performed mainly and mainly by biceps muscle. So keep this thing in point. Most of you don't know this. So keep it in mind. Biceps muscle is the strongest supinator. Right, so biceps is your strongest supinator of your body. So keep this thing, print it in your mind. Biceps is your strongest supinator of your body. Okay, now another important, by the way, I can show you the muscle over here, right? So you can see this is what is this process over here? This is called as your coracoid process. So it is arising from the coracoid process, and not only that, this tendon is also arising from what? Supraglenoid tubercle, right? So all the way, coracoid process is short head, supraglenoid tubercle is long head, right? So all the way this muscle comes down all the way and it inserts to, you can see here, this is the radial tuberosity where it is inserting. So this is your biceps brachii muscle. Okay. Now, one important thing is that sometimes it might happen like this. See, one end of the biceps is attached to coracoid and supraglenoid tubercle. Other end is attached to radial tuberosity. For example, just for an example, let us say that the tendon here is broken down like this. The tendon, the long head and the short head tendon, it is cut down. So when it is cut down, what will happen? What will happen is that, which is the only side that is attached here now, only the radial tuberosity is getting attached. So what will happen? The muscle is pulled down, right? So when the patient will flex, you won't see the biceps here in the center. You would see the biceps almost near the radial tuberosity down here. You won't see it here. You will see it here, right? So if I have to show you that picture, this is the picture how it looks. So actually biceps muscle has to be like this, but what has happened? Biceps muscle has moved forward. So guys, as you can see here, that this part of the bone, right? I mean this part of the muscle, the biceps muscle, right? So actually it has to be all over like this, but only one part of, I mean most of this muscle, biceps muscle has moved forward towards the radial tuberosity, right? So this kind of muscle, you call it as Popeye muscle. You call it as Popeye muscle, okay? Popeye muscle or Popeye deformity. So there is nothing, Popeye muscle is nothing but the biceps muscle itself which has moved forward towards the radial tuberosity, okay? So moving on to the next important thing, that would be the triceps. As I have already told you that the triceps muscle has got 3 heads. Now what are those heads? Remember by the mnemonic LML, okay? L stands for, we have got long head, okay? We have got the medial head, okay? We have got the medial head, we have got the long head, as well as we have got the lateral head. We have got the lateral head. We have got 3 heads as I told you, okay? So from where does this long head originates? Where does this medial and lateral head originates? We shall write it now. Basically guys, long head originates from infraglenoid tubercle. I have already shown you that scapula, I mean the glenoid cavity has got 2 tubercles. On the top this is called a supraglenoid tubercle, on the bottom you call it as infraglenoid tubercle. So it arises from infraglenoid tubercle, right? So most of you might have known this thing now. So this is called as your supraglenoid tubercle and the lower one is called as your infraglenoid tubercle, okay? Next important thing is that guys, so this thing which you are seeing right now, okay, so let us say this is the anterior surface of your humerus, okay? On the posterior surface of the humerus, you have got a groove like this, okay? You have got a groove. That groove is called as a radial groove, okay? So medial head is attached above the radial groove and the lateral head is attached below the radial groove, okay? Medial head is attached superior to the radial groove and lateral head is attached inferior to the radial groove. So one head is attached superior to the radial groove, whereas other one is attached inferior to the radial groove. So as you can see here guys, as you can see here. So what did I tell you? I told you that this is called as supraglenoid tubercle, this is called as infraglenoid tubercle, and we have already spoke about it, that supraglenoid tubercle. And what is the muscle that originates from the supraglenoid tubercle? That is the long head of the biceps brachii. And from the infraglenoid tubercle, right, from the infraglenoid tubercle, that is a triceps muscle. So infraglenoid tubercle, we have got a head, we have got one head, right? So that head we call it as long head. Next, from above the radial groove and below the radial groove also we have got a muscle, right? I mean, we have got the tendon. So from above the radial groove it is a medial head, and below the radial groove it is a lateral head of the triceps. So all of them together, right, all of them from these points together, they finally form the muscle on the posterior side, which attaches finally to your olecranon process anyways, right? So this muscle over here is called as your triceps muscle. This muscle over here is called as your triceps brachii. Okay, so what is this muscle? This is called as your triceps brachii. Okay, triceps brachii. Now as you go a little bit down here, now you can see this muscle. Okay, so very clearly you can see here that this is above the radial groove, and below the radial groove you cannot see because it is covering this thing. I mean, the medial head is completely covering the lateral head, so you cannot see it. But whereas the long head originates from the infraglenoid tubercle here. So whatever it is, all of them together are inserting to the olecranon process here. You see, this is your olecranon process, right? So they are inserting to the olecranon process of the ulna. So this bone is, I mean, this muscle, I'm sorry, this is called as your triceps muscle. Now hanging on to the next important thing, guys, now we shall be discussing the muscles of the forearm. Okay, so muscles of the forearm are very important, and all of you should know one very important thing, that as I have already told you in my previous lectures, that if I am sleeping like this, this is my anterior compartment or the ventral compartment, okay, or this is the anatomical position of my body. So in this anatomical position, whatever you can see here, this is called as the ventral side or the anterior side. Whatever you can see on the back, this is called as the posterior side or the dorsal side. Okay, and anteriorly, all these muscles which I have here on the ventral side, these are all called as flexors. They are responsible for flexion like this, they are responsible for flexion like this, they are responsible for flexion like this. Okay, and all the muscles which are located on the back are called extensors. They are responsible for the extension like this, they are responsible for the extension like this, they are responsible for the extension and extension like this, right? So they are called as extensors. Now when it comes to the forearm, again the same classification. So the forearm muscles, okay, the forearm muscles, so basically they are divided into two groups. So as you all of you know, just now we have spoke about, one is the anterior compartment. Okay, what is the other name for the anterior compartment? It is also called as flexor compartment. Next, after that we have got something called as the posterior compartment. What is the other name for the posterior compartment? That is called as extensor compartment. Okay, so we have got something called as anterior compartment or flexor compartment. Posterior compartment are also called as extensor compartment. Now within this anterior compartment, we have got two groups of muscles. So what are those two groups of muscles? We have got something called as superficial group, we have got something called as deep group. Okay, the moment you cut the skin, whatever muscles you can see, they are superficial, and when you remove the superficial, inside there will be some muscles, they are called as a deep muscles. So even in posterior compartment also we have got two groups, one is called as a superficial as well as the deep group. Okay, so now we shall be discussing regarding the superficial as well as the deep muscles. So first what I will be doing is that I will just write down the muscles and then I will explain you where are these muscles that are exactly located. Okay, so first important thing is that just remember it as like this. Okay, pass, fail, and again finally fail. Okay, finally fail. After that again you pass, again you fail. Okay, so this is the basic mnemonic which you need to remember, right? So how many P's are there? P, F, P, F, right? F, P, F. Okay, so actually the two F's whatever are there, they are very easy to remember here, but anyways I will be telling you what are they. So the first important thing or the first important muscle which you can figure it out here is that P stands for, the first P stands for pronator teres. The first P stands for pronator teres, right? Why it is called pronator teres? Because it is responsible for pronation. This is called pronation. Pronation is promising. Okay, supination is receiving. Pronation is promising. So next important thing is that, second important thing is that F stands for flexor carpi ulnaris. Flexor carpi ulnaris, or you also called as FCU. Flexor carpi ulnaris. Okay. After that, you have got the third one, that is P. P stands for palmaris longus. P stands for palmaris longus. Okay. And next you have got F. F stands for flexor carpi radialis. Flexor carpi radialis. Okay, and again after that you have got one more F I told you, right? So this F is flexor digitorum superficialis. Flexor digitorum superficialis. So whenever I tell flexor digitorum superficialis, there will also be profundus. When there is a superficial muscle, a particular superficial muscle, there will also be a particular deep muscle. So on the other hand I am writing it down, that is flexor digitorum profundus. Flexor digitorum profundus. And finally we have got P and F. What are these P and F? P stands for pronator quadratus. I will explain you in detail all these muscles, don't worry. Pronator quadratus. Okay, and the next one is flexor pollicis longus. Pronator quadratus as well as flexor pollicis longus, right? So all these muscles which I have written here, these 5 muscles, these are called as the superficial muscles, and all these 3 muscles which I have written, these are called as your deep muscles. Okay, now superficial muscles are pronator teres, flexor carpi ulnaris, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus is the deep, pronator teres and flexor pollicis longus are also the deep muscles. Now out of all these muscles guys, what is the nerve innervation, I will tell you at the end when I explain you the muscles. Okay, so now let us look into each and every muscle. So we have just discussed guys that we have got superficial and deep muscles, right, of the anterior compartment of the forearm. Okay, now one very important point you need to know is that this is the humerus here. Now in this humerus, the lower part of the humerus, if you see, this protruding part is called as the medial epicondyle, right, whereas this one is called as the lateral epicondyle. Now which is more prominent guys? The more prominent one is medial epicondyle, which is protruding outward, right? So this is the most common one which is prone to fractures. Whenever you fall on an outstretched hand, so obviously this will break out. Now important thing to know is that all your flexor muscles, okay, all your flexor muscles, I told you, you remember it, right? I told you that anterior compartment is all flexors, posterior compartment is all extensors. So all these flexors which are here, they have a common origin. I mean all of them originate from a single point, that is your medial epicondyle, right? So if I am putting it up like this, if I am, okay, I think this is of the left side. If I am putting it up like this, right, so this is the medial epicondyle. So from this point itself, all the flexors, they come like this and attach. And from the lateral epicondyle, what will happen is that all the extensors will go back like this. So all the flexors are originating from the medial epicondyle and all the extensors are originating from the lateral epicondyle. Okay. So if I ask you, I mean there is also a question basically. So this one is the medial epicondyle, right? Medial epicondyle. condyle. So what did I tell you about the medial epicondyle? That medial epicondyle is also called as a common flexor origin. Common flexor origin. I am not telling that all the muscles will originate from medial epicondyle, but most of the muscles will originate from medial epicondyle, leaving one or two. Okay. Next, in the same way, this one over here, this is called as lateral epicondyle. One is medial epicondyle, other one is the lateral epicondyle. Okay. Now, in this lateral epicondyle is also called as a common extensor origin. I told you, right? So, this is a common extensor origin. And next important thing I want to highlight here is that sometimes it might happen like this, that because of overuse, right, what will happen is that the medial epicondyle, okay, mainly the medial epicondyle can undergo inflammation. So, inflammation of medial epicondyle, you call it as medial epicondylitis, medial epicondylitis, or the other name that is given for medial epicondylitis is golfer's elbow, right? Golfer's elbow. Okay. In the same way, sometimes the lateral epicondyle might also undergo inflammation, right, because of overusing. See, for example, golf. How do you play the golf? You play the golf in this way, right? So it means you are stretching the hand outward. So it means the pressure is impended upon the medial epicondyle. So when you are all the time stretching the hand upward like this, what is going to happen? The medial epicondyle might get inflamed, right? In the same way, when I am throwing something like this, then more than the medial epicondyle, my lateral epicondyle, the impact on the lateral epicondyle is more. You see, the extensors, I am extending my hand, right? I am extending my hand and I am throwing it. So what will happen? The extensor point might get inflamed. Okay. So that thing you call it as lateral epicondylitis. Lateral epicondylitis. Or what is that sport which you extend and you play it? Yes, that is called as your tennis, right? So this is also called as tennis elbow. Tennis elbow. So one is called as your golfer's elbow, another one is called as your tennis elbow. So the clinical points, I am again and again telling you, clinical points are the life-saving points for your exams. Okay. Next important thing. So, okay, fine. So, you are telling medial epicondylitis means inflammation of medial epicondyle. So, from the knowledge which I know, from the medial epicondyle, all the flexors will originate. So, are you telling that if medial epicondyle is getting inflamed, then all the flexors will get inflamed? No, not all the flexors, but mainly two flexors will get inflamed. What is that? One is called as your pronator teres. Pronator teres will get inflamed. Second one is called as your flexor carpi radialis. Pronator teres and flexor carpi radialis. Flexor carpi radialis. So these are the two muscles that will get inflamed. So this can be an MCQ. Okay, this can be an MCQ. In the same way, on the opposite side, if lateral epicondyle is inflamed, then what are the two muscles that can be inflamed? I did not write the muscles of extensor compartment so far, right? But just remember these two names, because anyways I will teach you. So these two names are, one is extensor. If there is flexi carpi radialis, then there will be extensor carpi radialis also. Extensor carpi radialis brevis. Brevis means small muscle. Okay. And next, extensor digitorum. Extensor digitorum. Okay. So these also can be an MCQ, and this box is really very important, guys. I want all of you to study it. Okay. So simple thing, guys, we haven't discussed much. Medial epicondyle, lateral epicondyle. Medial epicondyle is called as common flexor origin, that is called as common extensor origin. Inflammation is called golfer's elbow. Inflammation of lateral one is called as tennis elbow. And muscles in the medial side involved are pronator teres and flexor carpi radialis. There it is, extensor carpi radialis brevis and extensor digitorum. Okay. Next important thing. So let us start the muscles, guys. So the first muscle here was pronator teres, right? So let us see, this is your pronator teres. Now how am I going to tell that this is a pronator teres? The first important point is that look at the origin. The origin of this muscle is arising from, as I told you, common flexor point, right? That is the medial epicondyle. Medial epicondyle. Next important thing is that the insertion. Where is the insertion point? The insertion point is, see, very easy to understand the insertion. This is the radius bone. This is the ulna bone. So it is attached to anterior surface or posterior. Obviously this is a flexor muscle, so it will be attached anteriorly only. So it is attached onto the anterior surface of the radius. Now within the radius you have got two lines, right? So one is called medial line, another one is called as the lateral line, isn't it? You can see here, see this line is called as the lateral line and this line is called as the medial line. Yes or no? One is the lateral, another one is the medial line. So this muscle is attached to anterolateral surface of the radius bone. Anterolateral surface of the radius bone. And what is the action of this muscle? As the name suggests, it is the name of this muscle is pronator teres. Pronator teres. Okay. So as the name suggests, it is pronator teres. It is responsible for pronation of your forearm. Right. So this is called pronation, this is called supination, this is called pronation and this is called as supination. So it is responsible for pronation of your forearm. Okay. So actually guys, if you look at this muscle so clearly, how does this muscle look is that, this is how the muscle looks. So let us say, for example, this is your humerus, the distal end, okay, and this is the muscle like this. So this is the muscle, okay. Yeah. So this is your entire muscle, this is your pronator teres. Now what I am trying to explain you here, is that there is a nerve, guys, very important, keep it in mind. There is a nerve that comes all the way down like this, okay. So this comes like this, it passes behind the pronator teres muscle, but you see there is a opening in the pronator teres muscle here, right. So there are two heads of the pronator teres. So between the two heads of pronator teres, this nerve passes down like this. Okay, this nerve passes down like this. Now why am I telling you this is, by the way, the name of this nerve is median nerve. The name of this nerve is median nerve. So sometimes it might happen like this, that I mean actually here itself you have got your pronator teres and here itself the nerve is passing. So sometimes what will happen is that whenever this pronator teres is contracted, whenever the pronator teres contracts, what will happen is that the nerve is passing like this, pronator teres is contracting it, then what will happen? The nerve will be compressed. So this syndrome you call it as pronator teres syndrome. What is this syndrome? This syndrome is called as pronator teres syndrome. Keep this thing in mind. This is called as pronator teres syndrome. So what will happen because of that? I will tell you later on what will happen when median nerve is damaged, okay. That time I will tell you all these things. So this is called as pronator teres syndrome. So for now what you need to remember is this. This is the clinical point which you definitely need to keep in your mind. Clear? So this is your pronator teres muscle. After pronator teres, the second muscle which we went on was our flexor carpi ulnaris, right. So let us look at flexor carpi ulnaris. Now look here, what is the origin of this? Origin is again the medial epicondyle. Origin of this is again the medial epicondyle, and how this muscle is passing is that, guys, look here very carefully. This muscle starts from the medial epicondyle. Now this muscle is moving like this on to the radial side, I mean the lateral side, right. It is going on to the lateral side like this. Now it is coming down all the way. It is even crossing your carpal bones. Okay, it is even crossing your carpal bones and inserting it to your metacarpals. Okay, so how is it passing? Look, this is a flexor muscle. So the name of the muscle will be flexor, and it is passing towards It is passing towards the carpal bones. Carpal bones on which side? The radial side. So these are the carpal bones on the ulnar side. These are the carpal bones on the radial side. So it is passing towards the carpal bones on the radial side. So flexor carpi onto the radial side. So radialis. Flexor carpi radialis. Flexor carpi radialis. So this is the muscle here. And again I am telling you, origins and insertions are not needed for you to know. Okay. But if you wanted to know, just keep in your mind that this if you look at the numbering here, 1, 2, 3, 4 and 5, it inserts, the flexor carpi radialis inserts to the second metacarpal, where it inserts to the base of the second metacarpal. Okay. So it inserts to the base of second metacarpal. Okay. It inserts onto the not the base, I think it is the proximal side of the second metacarpal, right? Proximal side of the second metacarpal. After flexor carpi radialis, we shall move on to the next muscle. That muscle is called, okay, let me draw that muscle and then I will explain you. So this is your medial epicondyle all the way, and let us say that here this is just a rough picture guys, not exact picture. So you can see the carpal bones 1, 2, 3, 4, 5, 6, 7 and 8. Okay. Now on the surface of these carpal bones you have got a fibrous sheath like this. Okay, because all the carpal bones have to be kept intact. These are small stones, they can go away anywhere. So all of them are kept together with, and they are surrounded with a fibrous sheath like a cloth. Okay, and this fibrous sheath is called as flexor retinaculum. What is this fibrous sheath called as? It is called as flexor retinaculum. This is called as flexor retinaculum. As you can see this is a flexor retinaculum. Now there is a muscle that originates obviously from the medial epicondyle, and this muscle comes all the way, and you know, by the way, this muscle has got very short belly like this. Very short belly. Okay, and this muscle has got very long tendons, and these tendons they attach to the flexor retinaculum like this. It attaches to the flexor retinaculum like this. Okay, it attaches to the flexor retinaculum like this. Okay, so this muscle is attaching to which point here in the body, right? Where are your carpal bones, by the way? Your carpal bones are not here, your carpal bones are here exactly. This is the place where your carpal bones are located. Okay, so they are located in the palm region. So this muscle is also attached to the flexor retinaculum which is on the palm. So this is called as palmaris, and the tendons are very long, so it is called as longus. So the name of the muscle would be palmaris. The name of the muscle would be palmaris longus. Okay, and remember one clinical point on this, that during tendon grafting surgeries, right, wherever a tendon is needed, they basically cut down this tendon and they put it there, okay, stitch it there. So during tendon grafting surgeries, we use some long tendons in our body. We take some long tendons in our body. We do the grafting technique and take out some long tendons in our body, right? So in this grafting procedure, the tendon which we use is palmaris longus. Not only that, even in the leg region also, we have got one more thing called as plantaris. Even that also has got a long tendon. So even that also we can use for tendon grafting surgeries. Okay. So remember one very important MCQ here that I just told you here. For tendon grafting surgeries, we basically use this palmaris longus tendon. Next important thing is that palmaris longus has got tendons, I told you, isn't it, right? Palmaris longus has got tendons, I told you, right? So these are the tendons. These are the tendons of palmaris longus, right? So these tendons, they go like this. These are the tendons of palmaris longus. Now, in between these tendons, you have got, in between these tendons, whatever thing I am drawing here, this is called as aponeurosis. What is this? This tissue here is called as palmar aponeurosis. This tissue over here is called as palmar aponeurosis. This is called as palmar aponeurosis. Now, why it is so interesting here? Because what will happen is that one very important I am going to tell you is that, so on the medial side here, this palmar aponeurosis gets completely hard and stiff. Why? Because a lot of fibers gets deposited there. A lot of fibrous tissue gets deposited over there and makes the medial half of the palmar aponeurosis so stiff. So when it will become so stiff, how does the tendon here exactly looks? Look on the opposite picture over here. This is how the tendon looks. Okay, and this condition where the medial half of the palmar aponeurosis becomes stiff because of excess amount of fibrous tissue deposition, this condition you call it as Dupuytren's contracture. What is this condition? This condition you call it as Dupuytren's contracture. This condition you call it as Dupuytren's contracture. Okay, right. So this is a very important thing you need to know. I mean, this is one of the very important clinical point, right? So in the palmaris longus tendons, I've just told you two clinical points. One is this Dupuytren's contracture, and the next one is your tendon grafting surgeries. For tendon grafting surgeries, we basically use this particular tendon here, right? Next important thing is that, see, this is the muscle, this is another muscle here. Now, how do you name this muscle? First of all, look from where it is originating, that is very important. So, it is originating from the medial epicondyle. So, the origin is from the medial epicondyle. It means this is a flexor muscle. Medial epicondyle. It means it is a flexor muscle. Now, this muscle originates from the medial epicondyle and it moves all the way down like this onto the ulnar side, onto the carpal bones of the ulnar side and attaches here. So, it means it is a flexor muscle. So, I am writing it as flexor. It is going towards the carpal bones on the ulnar side only, not on the radial side, right? Carpi, very good, ulnaris. Flexor carpi ulnaris, right? Flexor carpi ulnaris. Now, where this muscle is inserted, that is a very important thing here. If you can look here down, let me decode this picture over here. I'll make this picture a little bit simple. You know, 1, 2, 3 and 4, 5, 6, 7 and 8, and we have got 1, 2, 3, 4 and 5 metacarpals, right? So, all of you know that this is the first metacarpal, this is the fifth metacarpal. And what are these carpal bones over here? What are the last two carpal bones? She likes to play. P in the sense this is pisiform. Try to catch her. H in the sense this is hamate. Okay. Now look here very carefully. Now this muscle all the way comes down, but remember one very important thing, guys. Between the carpal bones, you have got a ligament here, right? This ligament is called as intercarpal ligament, or between the pisiform and hamate bone, we have got a ligament. This is called as pisohamate ligament. Pisohamate, let me write it. Pisohamate ligament. This is called as pisohamate ligament. And you have also got a ligament between the hamate bone and the fifth metacarpal. This is called as carpometacarpal ligament. What is this called? Carpometacarpal ligament. Okay. Now this muscle comes all the way down like this, and it inserts to your pisiform bone. It also inserts onto your pisohamate ligament. It also inserts onto your hamate bone, and it goes down. The tendon goes down and also inserts onto your carpometacarpal ligament, and finally it inserts onto your fifth metacarpal. As you can see in the picture also, the same thing is given in the picture, right? So it is attaching all the way down there. Okay, so insertion points I think need not to write because you can figure it out from the picture itself. Okay, so these are the insertion points. Let us go on to the next muscle now. So let me write down the, first of all let me draw the insertion point, I mean the origin point here, guys, very important. So as all of you can see here, that this is your radius, this is your ulna. Okay, this is your radius, this is your ulna. Remember one very important point, that on the surface of ulna, on the ulna bone, we have got a small tubercle here. On the head of the ulna, we have got a small tubercle, and this tubercle you call it as, what do you call it as? You call it as coronoid process. You call it as coronoid process of the ulna. Okay, not coracoid process. Coracoid process is different. This is coronoid process. Okay, so this is very important thing you need to know. Next important thing is that on the radius bone, you have got a line like this, an oblique line. This is called as an oblique line of radius. What do you call this as? You call it as oblique line of radius. Oblique line of radius. Actually, there is a ligament, guys. Now, this ligament starts all the way from the coronoid process till which part here? From the coronoid process till the oblique line of the radius. So, it is making an arch. So, that is why it is called as an arcuate ligament. And what is a ligament? This is called as arcuate ligament. Arcuate ligament. Okay. Now, this muscle which I am going to tell you, this originates from medial epicondyle. It also originates from the coronoid process. It also originates from the arcuate ligament, and it also originates from the oblique line of radius. So, from all these points, this muscle originates down all the way like this, right? So, this is the entire muscle like this. Okay. So, this muscle is named as flexor and where is this muscle inserting, guys? This muscle is inserting to your digits, your phalanges. So, digitorum, flexor, digitorum, and we are discussing the superficial group first. So, this muscle would be superficialis. Flexor, digitorum, superficialis. Okay, and very important thing you need to remember, is that flexor digitorum superficialis attaches to the middle phalanx. How many tendons do we have? We have got 4 tendons. You can count here. We have got 1, we have got 2, we have got 3, we have got 4, and these 4 tendons are attaching to the middle phalanx, right? So, this will be your distal phalanx, this will be your middle phalanx, this will be your proximal phalanx. So, it is attached to the middle phalanx. You can look at the picture. Okay, so I can write it down, right? Flexor digitorum superficialis inserts to the middle phalange. Middle phalange. Okay. Next, when it comes to flexor, this is another muscle. This is also a flexor muscle because it is originating from the flexor point. So, this is called as flexor. And where is it inserting? To the digits. So, digitorum. So, previously we discussed superficialis. Now, it will be profundus. Flexor digitorum profundus. Okay. Now, look at this muscle very carefully, guys. So, this is the muscle actually. Okay. So, this one over here is the muscle. You see, this is the muscle here. And how many tendons does this muscle have? 4 tendons. 1, 2, 3 and 4. Then what is that tendon which is attached? That is a different muscle. I will tell you later on. But this is the muscle which I have drawn. So, this muscle has got how many tendons? We have got only 4 tendons. But where is this muscle inserting, guys? Look here. Is this muscle inserting like the previous one? Is it inserting to the middle phalanx or is it inserting to the distal phalanx? Yes, this muscle is inserting to the distal phalange. Okay. So, this is the key difference between flexor digitorum superficialis and flexor digitorum profundus. Flexor digitorum superficialis attaches to the middle phalanx and flexor digitorum profundus attaches to the distal phalanx. So, this is a very important thing you need to keep in mind. And how many tendons? Obviously, 4 tendons only. Then what is this muscle which is arising from the other side here? Okay, let us name this muscle. Obviously, all these muscles are flexor. So, this will also be a flexor muscle. Okay, and where is it is attaching? It is attaching to your thumb. And what do you call your thumb in the Latin? You call it as pollicis. So, it is flexor pollicis, and look at the tendon all the way from here till here. The tendon is very long. So, longus. So this muscle is flexor pollicis longus. And where is this flexor pollicis longus attached? It is attached to the distal phalanx. It is also attached to the distal phalanx. Okay. So keep this muscle in mind, okay, because later on I will tell you one very important clinical point. That time this muscle, I will draw this muscle once again, and that time you have to know. So remember only 2 points. Flexor digitorum, flexor pollicis longus has got long tendon and it attaches to distal phalanx of your thumb. Okay, distal phalanx of your thumb. This is the only thing which you need to remember.